Brace yourself. Millions of Americans are on the brink of losing their health coverage, and it's all linked to President Donald Trump's latest tax and spending bill. According to a new, nonpartisan Congressional Budget Office, CBO, analysis, roughly 10 million people face the real possibility of losing health insurance over the next decade as direct fallout from this sweeping law. But here's where things really get heated. For Medicaid alone, the situation is especially striking. The CBO projects that about 7.5 million current Medicaid recipients will be dropped from the program. Why? Because under the new rules, adults who receive Medicaid, unless they're disabled, must either find a job, enroll in school, or volunteer to keep their coverage. If that's not tough enough, states now have to double-check Medicaid eligibility twice each year instead of once. Think about what that means. More paperwork. More chances for people to fall through the cracks. Meanwhile, the Affordable Care Act ACA is taking a hit as well. The same CBO report expects another 2.1 million people to lose ACA coverage by 2034, while an additional 400,000 will lose insurance due to other changes triggered by what politicians have dubbed the One Big Beautiful Bill. The legislation strongly backed by congressional Republicans. And this is the part most people miss. The financial impact of these changes isn't the same for everyone. The CBO spelled out the winners and losers with stunning clarity. The poorest Americans, those making under $23,750 annually and paying about $2,300 in federal taxes, are set to lose around $1,200 a year because of Medicaid changes and cuts to food assistance programs. Middle-income families might see a modest annual gain of $800 to $1,200. But wealthier households? They stand to gain, on average, a hefty $13,600 a year in tax breaks, even though families earning over $690,000 will still pay a hefty $200,000 in federal taxes every year. As a controversial point, Sabrina Corlett, a leading expert from Georgetown University's Center on Health Insurance Reforms, didn't mince words. This is one of the most regressive pieces of legislation I've seen. The rich will get richer and the poor will get poorer. Do you agree with her assessment, or do you see things differently? But the story doesn't end here. Some earlier CBO forecasts suggested that nearly 12 million could end up uninsured if Congress fails to keep in place the temporary tax credits, those big COVID-era relief measures that have helped make ACA plans affordable. So what happens if those credits aren't renewed? Nearly 5 million more people could find their coverage unaffordable and lose it. And here's another layer of trouble. If you benefit from those pandemic tax credits, brace yourself. The amount you'd have to pay could skyrocket by over 75%, according to health policy experts at KFF. To make matters even tougher for everyday consumers, the combined pressures from Trump's tax law, the likely expiration of those tax credits, and rising medical costs mean insurance premiums are about to jump for everyone. In fact, insurance companies are planning a median premium hike of 18% for 2026 ACA plans, the highest rate increase since 2018, according to a recent report from the Peterson KFF Health System Tracker. So let's ask the tough questions. Is this legislation a necessary move toward fiscal responsibility, or does it unjustly tip the scales in favor of the wealthy at the expense of the most vulnerable? Are stricter Medicaid requirements improving accountability, or setting up barriers that hurt hardworking families? Tell us where you stand in the comments. Do you see these changes as inevitable reforms, or do you worry they'll push millions into crisis? The debate